Welcome back, Ji. My name is Shakil, Salam, and you're watching Hamari Sehat on Sky 820 Ummah channel. Dr. Ishfaq Ahmad is with me and he's talking about abdominal pain as well as IBS. We talked about a lot of home remedies as well as the cause, and we are looking at the treatment of IBS now. If you got any questions, this is your last opportunity. The telephone lines are open. You can see the number on the screen in a minute. Please do call us and ask any question. If you got any home remedies which you use for your abdominal pain, please do call us and let us know. Mashallah, excellent feedback on our social media, and people are responding, including your shirt is very popular. And also your totke about Zubeda Appa, Saunf and Ajwain and other things. So let's look at treatment, So basically, first point of contact is go and see your doctor. Don't delay it.
I think if we, there are not worrying features, then really you don't need to see your doctor either. So you can initially try those remedies or diets which we have discussed before. But if those do not work, and then there are few over-the-counter treatment available, you don't need your doctor's prescription for that. And first of all, there is a peppermint. I think we haven't discussed peppermint in the totke or home remedies. Peppermint oil is very good for irritable bowel syndrome. So you can buy over the counter from the health shops or from chemists peppermint oil capsule, and if you take that one capsule three times a day with your each meal, so that will improve the symptoms of around 15 to 20%. So it doesn't help in everybody. So once you have tried peppermint oil capsule, it doesn't work, you can go to the pharmacist again and then ask for, there is a drug called mebeverine or Colofec. And it is, again, this drug is available over the counter. So you can use that whenever you get the symptoms for a week or 2 weeks, and you can keep a supply to control the symptoms. These are the sort of two over-the-counter drugs which you can buy and then use it whenever you need it. But obviously, if your symptoms are not improving with dietary modification and over-the-counter remedies, then you should consult your general practitioner. And in sort of severe cases of irritable bowel syndrome, once we have excluded other structural underlying problems, we do try a small dose of antidepressant. As I mentioned before, that the stress and depression is an important factor in the IBS. That usually the majority of these patients with irritable bowel syndrome have got a lot of stress and depression. So we use a very old antidepressant drug, which is called amitriptyline, in a very small doses. We're not using as an antidepressant, and majority of our patients then suddenly turn around and say, I'm not going on to antidepressant. And actually it is a tiny dose which is not going to have any impact on your mood or your depression. It is basically given to block the chemicals which actually relay the messages from your stomach to the brain about the bloating and the gas. So this is a very good and very effective drug which we use in the severe irritable bowel syndrome, and it works wonders. It takes about 6 to 8 weeks, and it helps to let them go to sleep. And only side effect is a little bit of constipation, because majority of IBS patients do get diarrhea, but this side effect is quite useful for them as well, because they get a bit of constipation, they get a good night's sleep, and they feel very relaxed. And if this drug is working, then we recommend that you should continue for approximately 2 to 3 years. And lastly, there is a stress relieving exercise. There is a special a treatment called cognitive behavior therapy, which is basically allows your mind to relax and detach yourself from the environment. So if you have gotten access to, these days there are a lot of small private clinics. They do provide these kind of behavior therapy sessions, and these are quite useful for irritable bowel syndrome.
Okay.
And then the last night I met a medical doctor who is a herbalist and also doing acupuncture as well in Birmingham. So he does treat a lot of patients with irritable bowel syndrome. There is a good treatment with acupuncture if you can find the proper person who can do the acupuncture.
Absolutely. Thank you very much for that. A question from a brother. What is the treatment for anal itching and the piles?
Pile. I can tell you a little bit of joke about it first.
Okay, all right, joke, yeah, that's it. I didn't realize you tell jokes as well.
No, it's not joke. I was doing a list, endoscopy list last weekend, and somebody told me that, you know, the cream for hemorrhoids, it's called Anusol. It's freely available over the market. Any supermarket will have it. And actually, it is very good for facelift.
Okay.
And a lot of supermodel use that hemorrhoid cream for their eye bags.
All right, okay.
And to lift the face. So I was surprised. So for the itch,
Anal itch, yeah.
Anal itch, yeah. So going back to your question of anal itching, number one, hygiene is very important. Cleaning with water and with tissue paper. And secondly, if they have got hemorrhoids, and most of people do have got hemorrhoids, there will be very few who don't. Hemorrhoids are either internal or external, and they do cause itching and everything. If the hemorrhoids are bleeding, you can use the hemorrhoid cream or ointment. In the supermarket shelves, there is Anusol, which is used for the facelift.
A facelift as well, all right, okay.
Don't start using for the facelift, but you can use that cream in the morning. Once you have done your bowel movement, you use that cream, so that is very useful. But in a very minority of cases where the symptom does not improve with hygiene, avoiding constipation and topical treatment, then you can discuss with your doctor. There is a treatment which is called the bending of hemorrhoids, which basically we put a band on the hemorrhoids which kills them. And if some individual who has got very large hemorrhoids which are protruding out of the back passage, they need usually surgery, but that is only a minority of the patient. But my sort of advice to the audience would be, if you are having bleeding, please do not consider that this is bleeding coming from the hemorrhoids. Make sure you have had proper investigation to rule out other causes of the bleeding. Bowel cancer and colitis is another one. So you must have investigation before you presume that your bleeding is due to the hemorrhoids.
Okay. That's fantastic. We got a tiny bit of time, but we're going to talk about prevention side of it and to get some key message from our guest. If you would like to ask any question, this is probably your last opportunity. We're getting a lot of text messages and the messages on social media, and we're trying to sort of include everything we talked about today. So Jazakallah for your all feedback, response, and thanks for coming along. But there's a couple of more things, you know. What will be the how can we avoid all IBS, abdominal pain, gas, bloating, everything, you know, before it's too late? So what is prevention?
Prevention, first of all, I can assure that IBS is not a serious illness.
So nothing to worry about?
Nothing to worry about. That's number one thing.
Because if you get stressed, it'll be even worse.
It will be worse. and the majority of the patient which consult the medical department or GP or the consultant are worried that they have got something underlying. So once we have ruled out that there is nothing underlying sinister abnormality like cancer or colitis or Crohn's disease, then 70 to 80% of our patients are fine. They said, okay, fine, I can live with these symptoms. And usually what happens is after 3-4 years, once their circumstances changes, their job changes or their home circumstances changes, their symptoms gets better suddenly. So they don't need to worry about these symptoms. Secondly, I think we haven't talked about exercise. which unfortunately I don't find much time to do one.
I'm really surprised, you're doing everything.
That's unfortunately is my sort of biggest weakness. So I'm on a exercise schedule for the next 6 weeks to get fit.
All right.
So exercise is actually, first of all, exercise is very good for depression.
Okay.
For stress, and it gives you very good sleep. And once you had a good sleep during the night, majority of your problems actually disappear in the morning. So exercise, you may take it as a prevention for various other conditions like blood pressure, diabetes, sugar, irritable bowel syndrome. So exercise is important if you can build into your daily routine. So it has to be more or less every other day, not that you're doing like me once a month. And I did it last month and I was suffering the following day. So you have to do on a regular basis. And secondly, the smoking, which I haven't mentioned so far, is also not good for...
Smoking is not good for anything, is it?
For anything, that's correct. And somehow if you can...
So where is the connection of IBS and smoking? Is there a link or...?
There isn't any kind of link published in the published literature, but the smoking overall is not good.
It's not good.
Not
Yeah.
good for your health
Right.
anyway. So I think I wouldn't advise to smoke. And
Not to smoke.
Not to
Avoid
smoke.
smoking.
Avoid smoking. Yeah. And if you have got some kind of activities, you socializing not on the Facebook but physically with other individual, so that actually also releases your stress as well. And somehow that will improve your irritable bowel syndrome as well. So I think going out, meeting people, socializing is a sort of stress reliever that will help your irritable bowel syndrome as well. And usually what happens is then the patients with IBS, they're a bit depressed, they remain isolated, they remain stay in their homes, don't go out, don't socialize, and that's why their symptom is a vicious circle, their symptoms get worse. So these are just kind of preventative things they can do.
So plenty of exercise.
Yeah.
No smoking.
No smoking.
Balanced diet.
Balanced diet, yes, correct.
Fruits are okay. Some fruits.
Some fruits are okay, not all of them. If you eat small quantity, there is no issue.
There's no issue.
But if you want to say that I'm going to eat 1 kilo of mangoes. Or grapes, then you're inviting a trouble.
What about tea, coffee, and all these drinks? You mentioned about fizzy drink, but what about coffee and tea?
Tea and coffee is okay in IBS. It doesn't cause worsening of the symptoms, and some kind of teas are actually quite useful for IBS patients, like lemon tea, ginger tea, peppermint tea. So the tea is okay for IBS.
Kashmiri chai?
Kashmiri
There's
chai,
no research being done on
there is, I don't know, but it has got a lot of sugar in it.
It's got a lot of sugar in it.
And I will doubt it will be.
But kawa, but lemon tea is good.
Green tea
and
is,
ginger tea or green tea.
Green tea is very good for your stomach and digestive system. Yeah.
And ginger tea.
Ginger tea as well, yeah.
Okay, that's absolutely fine. And chewing gum, avoid chewing gum as well.
Avoid chewing gum, that is no good, no, not at all.
You're telling us everything.
No, chewing gum is...
We can't have fun anymore, isn't it?
Well, you can go out and socialize with the people, meet and discuss.
Without having chewing gum?
Without having chewing gum, without having alcohol.
Eating white rice, white chapatis.
White chapati, yeah.
No Brussels sprouts.
No Brussels sprout, no beans.
No beans.
No cabbage.
Yeah.
No artificial sweetener, no diet drinks.
So I think next time I'm going to have a full list and see which food can I have it.
Yeah.
Absolutely fine, yeah. So Dr. Ishfaq Ahmad is telling us about abdominal pain. Any diarrhea, people are asking about, is there any treatment for diarrhea? What is the best option for diarrhea?
Diarrhea, in a proportion of individual with IBS, they get the diarrhea.
All right. Okay.
And then again, if they can avoid certain foods like lactose, the dairy product, artificial sweetener, their diarrhea will get better. And if it doesn't get better with the dietary modification, they can use the over-the-counter remedies we discussed, peppermint oil capsule and mebeverine. If that doesn't help, they can simply take a Imodium pill in the morning. So that will control their diarrhea. But if they make a food diary, they will know which food is causing them the diarrhea. And they can actually write what they have eaten for about a week, and they will know that this is the food when I ate, and a few hours later I had a diarrhea. So the food diary is important. That can link what kind of food they can't eat, and then in future they can avoid it.
Okay. So some key messages. What would you like to tell us, what we need to be careful about?
I mean, the key message is, I think first of all, if there is a acute, severe pain which you never had it before, don't sit on it and dial your emergency numbers, usually 999, or emergency doctor. So that is for acute, severe pain which you never had it before. And secondly, if your age is less than 50, then there are no alarming symptoms, particularly the pain waking you up during the night, blood in your motions, weight loss, or fever. If you have got these symptoms, then you should contact your GP immediately. Any individual over the age of 50 with IBS symptoms, they should again contact their GP. They should not try home remedies or any over-the-counter remedies.
Okay, that's absolutely fine. And to be honest, I'm just looking at there's loads of people putting picture of you on Facebook and social media, and you look fantastic in your T-shirt, and people are sharing your pictures and all that. But one of the important thing is let's talk about some of the success, because you're the finalist for NHS Regional Award of Doctor of the Year, and ceremony is going to take place on 18th of November.
That's correct.
So you'll be there, and that is the time you probably see whether you are.
Yes, I think there are possibly three finalists in the whole of...
Well, you are on the finalists, isn't it?
I'm one of the finalists.
Yeah, you're one of the finalists.
I'm one of the finalists.
So that is the big achievement itself.
Yes, I think I'm grateful for the people who nominated me and my patients.
So where this ceremony is going to take place?
This ceremony is taking place in, there's a very nice hotel, Chateau Impany, in a Droitwich Spa.
All right. Okay.
So it is like a normal Oscar ceremony.
Yes.
So what they're doing is they're taking a video of me in a few days' time, and they're also asking the people who nominated me why they nominated me. So what happens is during the awards ceremony,
they will play that
on a very big screen, and then usually the envelope is open and a decision is made who is the Doctor of the Year. And I'm dreading that. I'm very nervous in attending that ceremony.
You shouldn't be nervous. I think you deserve it, and all the best. I hope you are you are a finalist anyway.
Yeah.
I hope you win the big day on the big day as well.
Thank you very much. I need a lot of your prayers.
Absolutely fine. Just briefly tell us about this. 3 months ago, you started this mobile clinic project in Pakistan. What is it?
Actually, it's a project of Association of Pakistani Physician and Surgeon Society, and which is now recognized charity in UK. And mashallah, we have collected nearly more than £100,000, and we are very grateful to our donors. A lot of people supported that good cause, and we have now started a proper clinic in mobile clinic, which basically there are 2 pilot sites which has started in Pakistan in the remote villages, and a qualified doctor along with all the equipment in the ambulance goes to the various villages and see the patient there and examine them, and they can actually give the free treatment over there if they have got some kind of suitable treatment. If some patients who require some further investigation or admission to hospital, they will bring them back to the city, and we have got a mashallah network of quite a few charitable hospitals which can then look after those individuals. As you know that we are very fortunate that in NHS in UK, which is one of the best system in the world and one of the most cost-effective system, that everything is free. Imagine somebody can't see due to cataract, and a cataract operation only costs £25. So I think £25 can give somebody their vision, and a lot of people, we are so grateful that they have donated so much that, mashallah, we have got two clinics starting, and our dream is to spread the network of these clinics in whole of the Pakistan. So I'm sure with our dynamic leaderships, which is Dr. Iqbal is one of the most inspiring leader in our organization.
And finally, where this idea of becoming chair of matrimonial committee for APPS UK, is that because successful marriage, your experience, that count with this, or is something that you wanted to take up as a challenge?
I think it's a huge challenge, and it requires a lot of time. And I'm spending some time as well. I wish I could spend a little bit more time. And first of all, I'm grateful that they have given me this opportunity. It is a huge issue in our community. You wouldn't believe, and inshallah, we will make it a very successful, free of charge program for the community.
Absolutely.
And that's what we're working on.
Can I just say all the best for 18th of November?
Thank
that
you
is
very
the big
much.
day.
I need a lot of prayer.
We'll love to hear from you, so keep us up to date. And all the best for future. Inshallah, we'll see you again sometime, whenever you got time. I know you're a busy person, but at the same time, we really appreciate when it comes to Ummah and the community engagement, you're always there and you always support us. So with that note, can I just say thank you very much for coming along.
Thank you very much. I'm very grateful for the Ummah channel and yourself as well for your repeated invitations. And I really thoroughly enjoyed your comparing.
Open invitation from Ummah channel. So this is your home. This is your second home.
Thank you very much. I wish I could have a helicopter.
Well, we can arrange that. With that note, can I just say a big thank you to Dr. Ishfaq Ahmad for traveling a long way, and he have to go back as well. So inshallah, we'll see him again. But next week, we're going to talk about a local dentist who is going to talk about dental health among young people, children. So tune in, and I will wish all the best, and thank you very much for everybody who called in today. I'll take a leave, inshallah. Look after your health, and I'll see you next week. Allah Hafiz.